Hello, it's Peter here, and the video that follows is divided into two sections. The first bit focuses on the hands and the second on the feet. The idea of the videos is to guide you to use the mnemonic I love you within your practice, possibly when delivering a treatment focused on digestion and excretion, but also possibly to include in terms of teaching a patient or their carer about using specific points that will help with digestion and excretion. So thank you, enjoy. So I'm just going to show some simple movements to encourage flow through the large intestine on my model Stephen yet again. So obviously I'm thinking that you can include this within a more formal reflexology treatment. You might be able to teach some of these techniques to a family member. So I will show you the simple I love you routine on the feet to begin with, and I'll just add in a few little pointers for practice. Okay, so just to reiterate that I find when I'm working with reflexology that the meridians that flow through to the feet often can get stimulated and encouraged by working on the outside. So I'm often stroking along the edge and obviously working along this edge here, and likewise on the interior aspect here we're looking at the spine and encouraging the nerve conduction to the tummy areas to be working well. So again, I would normally be working the spine as well for that good effect, and actually working nicely down into here, which is very, I think, very therapeutic for encouraging digestive processes and excretory processes. So I'm just working those areas. Some of you are taught about the bowel helpers in the Achilles there, so I'll just demonstrate it here. Yes, you can work walking up and down with your thumb movements. That's probably normal practice. Always good to work around the hips because these are very good stimulating areas for the bowel. I tend to pop finger and thumb and I do little squeezes down the Achilles and then hold the ankles. So I'm working down, 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 little squeezes and down. So that's my preferred way because I get attention from both sides. Interestingly, good to work an acupressure point here called spleen 6. So I've just got my hand over this knobbly bone here and I'm just putting my fingers there, and just where that point is can often be tender. So is that a little bit tender? Yes. So that's my spleen 6. Good point as well for the bowels. So we're focusing on the I love you movement. Okay. So we're thinking that's the right foot. Yes. That's the left foot. So we're starting on the left. So we're sliding down with the I right to the end. So we're covering a good area. So I, all down. You can focus a little bit more on the last I as you come to the centre. I mean, in a sense, you're covering that lower part of the spine, but you're obviously covering the large intestine as it exits. So, okay, so we're doing I, okay. Then I'm going to cross over and I'm going to do the L. So I'm going up from the ileocecal valve in the corner there, okay, and I'm going up and across, okay, up and across, and I'm continuing on this side and then down. So I'm doing an L on that side too, down, okay, so I'm going up for L and across, up for L, and obviously in reflexology you can walk it, okay, you can walk it. But if you're just doing a simple movement, teaching a family member, you can just do a lovely L movement across, and I'm doing the reverse L down. So I'm connecting all parts. Yeah, so going across and down. And I say don't be afraid to go down with your L's so that you're covering all the small intestines as well. So we're doing shorter L's across, starting with a bigger L and shrinking down and shrinking down and shrinking down. Okay, L, 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 stimulating the flow. And of course you can combine these reflexology with some lovely creative imagery, thinking about journeys and things like that, that indicates, or as a metaphor for movement. So, and then we've got the U, so we're going to do an upside down U, okay, just to encourage flow. And again, you can shrink your U's. So I'm going to hold the heel so you can see. So I'm doing U's, U's, U's. Let's say you can do U's that way as well. I tend to do the reverse because I'm just thinking of a downward movement, downward movement, downward movement. Okay, I'm coming on to this side here. Again, I'm doing U, down, U, down, and do U down, shrinking my U as I go down. And again, you can do a reverse movement to really encompass all the points down beautifully. Okay, I love this movement. I think it's a really nice crossover movement across the tummy and sliding down. And again, stroking on the outside of the toe just to encourage flow. Okay, crossing, 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 going reversing up. One of the nicest movements, sliding down and then flowing up to stimulate flow through the meridians. Sliding down towards the heel, exiting, sliding down, and say, and then you can lovely sit and hold the feet and take a comfy breath in with your client, squeeze a little bit, and as they breathe out, just release the hold, let the feet feel nice and heavy and wobbly, okay, and let it go. You maybe do that 3 or 4 times, and obviously you can wrap the feet up and just make sure you're comforting the ankles, holding, and that's the I Love You integrated into reflexology. Thank you. Okay, well, on this second part of the video, I'm going to demonstrate working the hands to stimulate the digestive areas, but most specifically, actually, the intestine areas, which is what I'm after. I'm after encouraging bowel movement and peristalsis. So I am actually just putting a little bit of oil on my hands just because they're a little bit dry today, but you don't need oil for this. You can actually work dry if the person's skin is nice and moist. And as I say, the purpose of this is primarily to teach the patient to work the hands, and possibly doing this before a meal, or in the evening, but at least 3 times a day in order to encourage peristalsis and gut movement and digestive movements and also bowel movements. So I'm just stroking down, okay, and when we think of working the bowel, I'm often thinking of working the large intestine meridian and just working down towards the little finger with some strokes. So it's just useful just to stroke the fingers. And of course, you can open up the palm by just tucking your fingers under the thumb and just to open. Okay, so I'm just doing that as just a general opening for this manoeuvre. When I'm teaching a patient to do this for themselves, I just focus on 3 movements, which I will show you shortly. Also good to work around the bowel helper areas, so I'm just doing that as well. So that's really for you as a therapist, just working areas to work with. Okay, so obviously on the reflexology map, you've got all the areas of the tummy in here, the small intestines, and you've got the colon. So we've got small intestines, we've got the colon, and there's this connection between the two. So we've got bowel helpers in here, why I'm just paying a little bit of attention to it. And obviously in terms of reflexology, we've got the spine and the various nerves coming off feeding the gut. So all of these things are good to work. So in a reflexology session of the hand, I would work those sort of areas to stimulate peristalsis, to encourage normal processes going on in digestion. So this technique is, I'm teaching this to a patient. So I'm going to start with the left hand, and I would teach on the left because obviously I'm encouraging emptying on the left. And so for me, I would simply do my strokes down with the eye. You can, again, you can do it reverse. So if you're teaching a patient, you can just say stroking down. Okay, you can walk as a reflexologist, but just for the patient, if they're learning how to do this, just stroking down. So I'm doing I. Okay, so that's the I part. Then I'm doing the L, so I'm just working nicely. I'm sort of encompassing a little bit of the lower thumb, just to sort of get some processes in terms of the nervous system. So I'm just doing L, L, and L, and you can bring that closer in so that you're really getting some nice movement. So I'm doing little L's to finish with. So we're really nice. You can come back on yourself again. So when you're teaching the patient, you can just encourage them to do this L movement. So yeah, starting here, coming down, going across here, coming down. You're encompassing a lot of helper areas and working small intestine and large intestine. So we've done the I, the I, the I. So you can take it across if you want to, do the I, but you're really focusing on the colon. You're doing the L, the L, the L, the L, and the L. And then you can nicely finish with the U. See, I love you, I love myself if you want to. So you can do the U. So I'm just going to lift it up and just show it. Obviously I wouldn't do this in a live session because I don't want to cause any stress on the patient at all. I'm simply working the U into the system. Okay, so that's the U. So that is the left side. Okay, and we can just gently hold the hand for a moment afterwards if we're doing this as a treatment. But as I say, when you're teaching the patient, you're simply asking them to do the I movement, which they can do forward or back, just strokes. As I say, the L movement, so we're doing L and L and L, and then we're doing the U, the U, and the U. For them, if they want to, they can do it U like that. It doesn't really matter. What you're just doing is you're just encouraging flow. So don't be hung up on direction. It's important just to cover the area. So I'm going to do it again on this side. So obviously I'm just going to put the hand out so that you can see. This is to stimulate the large intestine. Okay, so we're doing I's. Okay, then we're doing L's, and we're covering it nicely. So L's, lower thumb, crossing over, crossing over, crossing over, crossing over. So lots of lovely L's, okay? And then U's, you can go that way, and you can reverse, reverse, you can go forward. You just want to get lots of coverage around this area. And it's just a way of remembering it by going, I love you, okay? So, and I say, you can do it that way. It may be seeing what your patient do and what they're comfortable doing, so long as you get that nice good coverage over the hands. Marvellous. And then again, I'm just holding as a therapeutic thing at the end, just popping my hand round and holding. Okay. Lovely, thank you. So what I'm doing, I'm just going to demonstrate again on my hand. is that I'm doing lots of these eye movements, okay, moving from the wrist up. I mean, you can stretch it out to the finger, and you can do reverse, as I say, I, okay, and then you can do L's, coming down, and L's, shortening the L to get to the edges, lovely, L, and then U, shortening the U's to get a really good concentration in this lovely edge of the hand. Okay, and obviously you do it on the other side. Thank you, Stephen. That's the I love you on the hands.